Have you ever heard this saying, if you don't have anything nice to say, just don't say it at all? I feel like people have forgotten that saying recently. uh, I don't know what it is, but like lately, people have been saying the strangest things to me, and this is people who actually know my situation. It's not just like strangers. I had someone tell me the other well, this was like probably a few months ago. So I was probably still an active, like I was still doing chemotherapy, which, I mean, no one's looking their best at the end of chemotherapy at all. Uh, I was told, oh, you look really good. Oh, except you don't have any color in your cheeks. Oh, yeah, no fucking shit, Sherlock. I'm being poisoned like weekly. Like, I probably don't have color in my cheeks. In fact, my whole skin is like turning yellow as we speak. Like, I had, like, it's like a thing. Like everyone kind of has like a yellow tinge to the skin. Some people it's a little gray. I don't know. It's just the coloring you get when you're getting poisoned. It is what it is. But anyway, yeah, I look good, but I don't have color in my cheeks. Okay. Um then I was told, "Oh, you look really really good, but your face looks fat. You have a fat face or you have fat cheeks." I'm like, "Okay." I don't really know how to I don't even know what to say to these people. I, I don't know if they're seeing like I'm not seeing something that they are. I don't know. I don't know why anyone would feel the need to tell someone that they have fat cheeks. Um I, I've lost like 30 pounds since April. So I don't think my cheeks are fat. If anything, they've gotten probably skinnier. And if they are fat, well, I was on like a pile of steroids forever. So that's going to make your face fat. Back in 2015, when I finished cancer treatments, I was up 20 pounds. And yeah, I had a fat face. And people had no problem telling me that either. I went back to work. I was a hairdresser. So I was exposed to a lot of people every day. And I had people so many people are like, "Oh, look at your fat little face. Oh, look at your fat little face and your bald head, and all the things." Like shut up. Like I know my face is fat. My whole body's fat right now. Like yes, I'm aware I don't have hair on my head. I had a lady. This was in 2015. I just went back to work. It was probably like my first or second week back to work. I hadn't even had surgery yet or anything. I'd just come back. I'd finished my last chemotherapy, and I think it was a week after that. Whatever. There was a waiting room full of people. We all had people in our chairs. It was a busy day. I think it was a Saturday. It was like a busy salon day, and this woman, no class whatsoever, and she was my client, and she was waiting to get her hair done. I was just finishing up with someone else, and she's like, oh, I didn't have my wig on either, so I had just like a kerchief thingy on my head because it was really hot. Like when you're in menopause, like at that point I had a human hair wig. It was really thick, really hot. I just couldn't work with it anymore, so I just had like a little head covering, little scarf head covering thing. And we're all busy doing our thing, and this woman's like, the fuck's wrong with you? Got cancer or something? Where's all your hair? I'm like, the whole salon, dead silence. You can hear a pin drop. I'm like, who says this? So I just like looked at her. I'm like, yeah, I have cancer or had cancer. Like, I don't know what you want me to say to this. Like, who says, like, just nothing like centering someone out and like making them feel like shit. Anyway, good thing I have tough skin, so it takes a lot for me to be like actually upset about things. But it was just really weird. Like, why would you say that? Like, some people, have just like a touch of class. Please do not say that to somebody. Don't center them out in a room full of people that they have no hair, that their face is fat. Yeah, your body's gonna change. People have changes in their body all the time. I've had people be like, hey, like, at least you get a free boob job. FYI, look into what reconstruction surgery is. It's not a free boob job. It doesn't look the same as a regular boob job when you get regular implants. Like, it's a whole process. Sometimes they don't use implants. Sometimes they use parts of your stomach. Sometimes they use like fat from your back. Like, there's a lot that goes into it. There's multiple surgeries that go into it. So no, it's not a free boob job. don't tell people it's a free boob job. It's not really something you should say to someone. Like, just don't say anything about their boobs if they're going through breast cancer treatment, because most likely they may have to lose their boobs and it's going to be traumatic enough. Just don't. What's another thing? People love to tell you, well, at least you have the good cancer. I have triple negative breast cancer. It's like one of the, like, if you Google like worst breast cancer, that's the one that comes up. There's that and another kind. So no, I don't have the good kind of cancer. Nobody has a good cancer. Yes, there may be cancers that are more treatable than others, maybe easier treatments, better treatments. But at the end of the day, don't tell someone that they have good cancer. That's really tacky. Nobody wants to be told that they have cancer, so just don't tell them they have the good cancer. And please, like, enlighten me what was so good about the cancer that I had, because I've had it now twice. I've had to do a ton of chemotherapy, multiple surgeries, radiation every time. I've now had my left side radiated, my right side's getting radiated as we speak. You're tired, it leaves you with horrible side effects that can last a lifetime. I'm now got crippling arthritis all over the place. Like, just getting up in the morning is a nightmare. Yes, it gets better throughout the day and I walk a lot and try to get things moving, but when I get out of bed, just walking to the kitchen to get a cup of coffee in the morning is horrible. So please don't tell someone that they have the good kind of cancer. There is no good kind. Just have like be a little sensitive. Don't comment on people's weights or bodies, because people are going through stuff and it's hard enough being the person going through it and knowing that your body might be changing or you're just sick all the time. Yeah, maybe my cheeks aren't fucking rosy. Like, there's nothing I can do about it. I can't help that I'm getting poisoned weekly or every 3 weeks and, my cheeks aren't quite as rosy. They're not rosy to your liking. Well, I'm so sorry. Not my fault. It is what it is. I think my cheeks are kind of rosier now, but whatever. Maybe my face got a little fat because I was on steroids. Again, big deal. You don't need to point out my flaws, because trust me, I know what my flaws are. I know what I'm self-conscious about, so you don't need to point that out. I can't wait for the things people to say when I stop wearing my wigs, because eventually I'm just going to wear my hair the way I wear it, and people just need to stop commenting all the time. Like, I cannot believe that people even think to say the things that they say, and I don't know if they're saying it because they're just uncomfortable or they don't know what to say. Why don't you just talk to me like I'm a regular human being? You don't need to bring up anything or say anything. Just say, hey, how's it going? Because you'll get a lot of that too. For years, I used to get, how are you? I'm like, good. No, how are you? And you get always the head tilt. How are you? Like, how are you? Fine. Like, I don't know what you want me to tell you. Like, I'm still alive. I'm not dying. Like, I don't know what that means. So again, like, when you're, if you're an outsider looking in on someone's situation, whether it be a cancer diagnosis or just anything, a hi, how are you is fine. You don't need to do the head tilt and like give them that sad look like they're dying in front of your eyes. Like, just treat people like normal people. If you're thinking in your head that they have a fat face or they've gained weight, keep it in your head. You don't need to say it out loud. It doesn't need to spew out of your mouth. Use the God-given filter that you have in your head. Please use your filters. Like, just think about what you're saying. Don't say stupid things. Like, I've just heard so many stupid things all the time, and it's just frustrating. And then of course people go home and they reflect on it or think about it and look at, like the day I was told I don't have color in my face or I had a fat face, I was in the mirror all day, like looking, I'm like, I don't know, my face looks like my face to me. Like, I mean, the color thing, yeah, I knew I didn't have color in my face. Like, my skin was getting very, like, pale and sickly looking, and it was what it was. My cheeks are fat. Well, I don't know. I'm 42 years old. I want to keep some fat in my face, to be quite honest. I don't want a skinny face because I don't want to look old. I like the way I look. I think I look fine. And once my regular hair grows back, I'll be even happier. But yeah, just just, if you have something weird to say to someone, if you think it's weird, please don't say it. Just have a little compassion for people that are going through stuff and just treat them like a normal person.